Welcome to the Tony Frida Show. Tony Frida here, and this is another episode of Mental Health Monday with Dr. Christine Marra. Hi, doctor.
Hi, Tony.
And we're lucky we have a psychologist on the show today because I'm going to be talking about something that reveals a psychologically disordered person's horrible tragedy, but also the ramifications of a psychologically disordered society. So every so often there's a crystallizing event that shines a spotlight into the darkest corners of everyday life. One terrible moment in which the pathologies of an entire age suddenly become visible and everyone slows down to stare at the carnage on the side of the road. The Lyndsay Clancy story is not just a Netflix series waiting to happen, which I'm sure it will. It's a story about the banality of evil. This is a woman who doesn't look like a Frankenstein monster. She looks like someone you'd see in a Walmart. But she is a monster. And she wasn't created by a singular Dr. Frankenstein. She was created by 13 Dr. Frankensteins. In the course of 1 year, she saw 13 doctors and was on 13 different psychological medications. He's on a total of 30 prescription medicines. 13 of them were psychological.
Psychotropic
Meds. So what if what we call treatment is actually making us profoundly sick? The question we want to ask on this show, and I know everyone's heard of Lyndsay Clancy's story because you'd have to be living under a rock not to hear about this horrible story. I go down my feed on any sort of social media, and every other post is about this, which is curious because it happened 3 years ago and nobody knew about it. And now everybody knows about it.
Yeah.
So the algorithm wants us to focus on this, which is, it's not why we're focusing on it. We're not just jumping on the bandwagon here, but this is a very important story because it reveals something that's profoundly sick about our society, how that manifests that into personal pathologies and results in the most horrific thing a human being can do, which is to brutally murder their own children. So we want to ask not just what happened to Lyndsay Clancy, but what's happening to us? So as you probably know, on January 24th, 2023, Lyndsay Clancy is a mother, suburban, normal mother by all accounts. She took her 3 children into the basement, Dawson, age 3, Cora, age 5, and Callan, 8 months old. And she held them down and proceeded to take one of these exercise band, put it around their necks, and strangle them to death. And she did this. She did this for 4 minutes, 4 or 5 minutes, because that's what it takes to murder someone. Now, I have a timer. I'm going to time 4 or 5 minutes at some point in the show to show you what she did to her own children for 4 or 5 minutes, 3 times. Now, from her own testimony and diary and the evidence that we have from her confession. By the way, she doesn't say she didn't do it. All the evidence forensically and circumstantially completely corroborates the prosecution's story, 100%. She doesn't challenge it. Her lawyers don't challenge it. It's only these lunatics online that challenge it. These very deluded wine moms who have nothing better to do. And we'll talk about them a little later because I got a real problem with these ladies. But because they're supporting her and they're disregarding the fact that 3 innocent babies were brutally murdered by their own mother. Where's the support for them? Where's the outrage and the protests and the vigils for these poor innocent babies? Imagine the last thing you see is your mother murdering you. Good God. There's a special place in hell for this woman. And I don't care because oh, I don't have sympathy for the mother. No, I have zero sympathy for her. And I'll tell you why. Because just imagine it was a man, right? Totally the same exact story. Oh, instead of postpartum, he has some other psychological disturbance and disorder equally as debilitating. And he's on 13 psychotropic meds, and he was not properly treated by the system. Same circumstances. And he held down his children and strangled them to death. You know how many men would be at a vigil supporting this guy? Exactly zero. And rightly so. Nobody would support this guy. So all you have to do in this story is change the sex, and it's a totally different story. So I'm going to hold her to the same standard I would hold a man to, because they're both human beings. I mean, there's no difference between men and women, right? But apparently there's a difference in the way we treat them when it comes to these sorts of crimes. So she brought Dawson, Cora, and Callan into her basement, and she laid them down. And Dawson, who's a 3-year-old boy, realized what she was about to do when she took out her murder weapon. And according to her confession, he started screaming for Daddy. Daddy, help me. Daddy, help me. So and he tried to stop her. Little 3-year-old boy trying to stop his mother from murdering him and his siblings. Imagine the terror this child suffered in the last moments of his life. So she took him into her husband's office, which was in the basement as well. And she strangled him to death first. Then she went out and she strangled the 5-year-old girl, Cora, to death for 4 or 5 minutes. And then she strangled her 8-month-old Callan for another 4 or 5 minutes. So 15 minutes, give or take, of brutal strangulation of your own children. This is a Mother of the Year we're talking about here. And these women, thousands of them that show up at the court, they understand it. They say they totally get it. And she was just brave enough to do it. And
are you able to show a picture of them, Anthony? They're the protesters wearing pink, right?
They're all wearing pink. No, screen share is not working. But okay. I'll put some pictures in the post.
Okay.
So I wanted to confer with Dr. Marra because she's had cases of postpartum depression. I'm not sure of psychosis, but I wanted you to speak to what is postpartum depression? How is it different than postpartum psychosis? And what is its distinction between insanity and incompetence?
Well, we'll get to the insanity and incompetence thing a little bit later, but
okay.
Postpartum psychosis is not synonymous with postpartum depression. Postpartum anything is an add-on to another diagnosis. It's not its own diagnosis in the DSM. It's usually an add-on to a bipolar 1 disorder, bipolar 2 disorder, or its own brief psychotic disorder diagnosis. It could tag along with major depressive disorder with postpartum. But postpartum is also, there's another phrase they're starting to use now called pericardium. So peripartum is when you might start to experience the anxiety or depressive symptoms that are a little more out of the norm during the pregnancy when you're still carrying. And postpartum is obviously after you delivered the baby. But we get a change in our hormones when we carry and when we deliver a baby, especially when we deliver, especially in the first 2 weeks. It's very common. I want to say it's about 80% of women will get some baby blues, just weepiness, tearfulness, just some anxiety, lack of sleep. So stressed out. This is like shocking change to your whole life, but it is definitely a significant change to your hormones that causes a lot of the weepiness. But when you get something longer than about 6 weeks long, more of a mood instability that lasts for longer than 4 to 6 weeks, it goes on for months at a time, then it becomes more clinically relevant and significant. Part of the problem is sometimes when people are in this state, they're breastfeeding, and maybe they could possibly benefit from an antidepressant or anti-anxiety, maybe. But when you're breastfeeding, right, you don't want to take anything during that time because then it goes into the baby's feed, what they get. But postpartum psychosis is what they're talking about with this particular case, because in order for Clancy to be convicted of this crime, they have to prove insanity. And in order to prove insanity, she has to have a psychotic disorder. And, as I said a few minutes ago, it will come under either a bipolar 1 disorder, bipolar 2 disorder, or just brief psychotic disorder. So it might be bipolar 1 disorder with an add-on of postpartum psychosis, or the same with bipolar 2. One of the things that makes somebody more likely to get these things is if they've already have a history in their family, if they themselves already have a history with bipolar disorder or even a major depressive disorder or significant anxiety disorder, but usually bipolar, it makes them more predisposed for these kinds of things. The other thing that happens also is sometimes with each birth, women do tend to get a little bit more, if they got some mood symptoms after their first pregnancy or during their first pregnancy, at their second pregnancy, they might be prone to a little bit more. And then by the third, it could get worse.
Yeah, she said, I think it was the birth of she wrote in her diary that the birth of her third child made her realize how much she hated being a mother.
Yeah. So, I mean, in a more personal way, my own personal experience, I've worked with several women that have experienced postpartum symptoms. Many years ago, I had a young woman who was on her fourth child, and she already had a history of issues in the family psychiatrically. So she started treatment with me in between babies. She was adjusting to a new location where she had moved to, and so she was coming to me more for some adjustment issues and some marital difficulties. But so she already had 3 children at this point, and they were all probably under the age of 7. So pretty significant stress. She was a stay-at-home mom, spouse worked, and they decided to have a fourth child. And I was concerned about it because there were already, like I said, some mental health issues in the family history, meaning family members already had some issues with bipolar disorder, and then she herself was struggling with different things. So she was already predisposed for some risk factors. So anyway, she went on to have her fourth child, and we were in treatment together for probably about a year at this point. And she started to get some psychotic symptoms. So I just want to preface this whole thing with, this topic is extremely difficult for me to talk about personally, not because I've had personal experiences. I'm not a mother, but because of the degree of violence that was done to these children. It's just unthinkable for me. So I apologize for that. So anyway, she started to get some, this patient that I had started to get some anxiety symptoms, tremendous anxiety, wasn't sleeping too well. She was having anxiety and hallucinations that something bad was going to happen to her children. That's really a delusion, right? That's not a hallucination. Delusion's more of a belief of something. a hallucination is an actual sensory experience of either seeing something that's not there, hearing something that's not there. It could go into your other senses, but those are usually the two ones that it hits when it's a hallucination. It's hearing voices, for instance, or seeing, things that aren't there. A delusion is a fixed belief that doesn't really conform to like norms, and when you try to convince somebody that what they believe isn't true, it doesn't matter. You can't convince them otherwise. So she was having a belief that something bad was going to happen to her children. That's what she was telling me. There might have been more that she wasn't saying, but she was terrified. She was obsessed about it, and she wouldn't stop obsessionally thinking about it. Now, I was fortunate that I worked in a practice with a very competent psychiatrist. So he was already treating her. So he already knew a little bit about her. But we both started getting emergency calls from her about her fears of harm coming to her children. And I was personally terrified that she was at risk for self-harm and harm to her children. And so I myself, was in constant contact with her as much as I could be. I would let her call me any day, any time. We would have sometimes 3 or 4 appointments a week. Any emergency or any phone call that was coming through from her, I would take it as soon as I could. And luckily, I said I had a good partner, a professional colleague partner that I was working with in tandem, who was, managing her medications in a very responsible way. And he was taking her calls as well. So this went on for, I'd say, a couple months where it was really terrifying. And he was a very experienced psychiatrist that I was working with. But I just felt like I had to be available at all costs, at all times for this person because of the risk level that I assessed her to be at, and he concurred. He was terrified that she was going to, what you call it in my industry is suicide on us. We were afraid she was going to suicide on us, but I also had the added concern of her obsessional thinking. She had these obsessional thoughts that something bad was going to happen to her children. She never said she planned to harm them, but sometimes you'll see with people with an obsessive compulsive disorder, they'll have this guilt-driven obsessional thought that when they're driving on the road, that they just might have run something over, and they have to keep going back and rechecking it. And she was having those kind of images in her mind that something happened to her children, that they died. So I guess, that's my main experience with this. And anytime I have worked with other kinds of patients with suicidality of different types, even separate from the postpartum type, any other types of suicidality that I've worked with, I'm completely and utterly at their disposal as much as I can be. And I ask them to give me updates about how they're doing. I ask them to check in with me. I don't care if I'm not getting paid for it. I'm not overly intrusive, like calling them or checking on them, but I ask them it's incumbent upon them to kind of keep in touch with me and give me updates. And I will, intermittently check with them, but you demand in-person sessions. So one of the troubles that's happened in the last few years, I feel, with mental health and a lot of medicine is that a lot of things are telehealth now. And, I personally do most of my work online as well. But if I was working with a high-risk person like this, I would not be doing it on a telehealth visit. It would be in person for sure. I didn't. There's so much to read on this story about what's happening with this case and all the practitioners, physicians, psychiatrists, psychologists that were involved, and nurse practitioners that are involved in this case. That it's a little bit overwhelming, but I think part of the concern and the problem that I see with all this is that from September or October until she murdered her children in January, this is 2023 into 2022 and 2023, I believe, right?
Yeah.
There were like, what, how many doctors involved?
There was 14 doctors who saw her at some point, and 4 of them were 2 psychiatrists, 1 psychiatric nurse practitioner, and then a therapist, and at least 1 more. So it's about 4 or 5 mental health professionals, and then the rest were emergency room people, inpatient people, but they all gave her scripts.
So the problem is with that so you see that many people being involved, whereas when I was treating this patient and my colleague was treating her with medication management, there was just the 2 of us. And it's not that we both had backups in case an emergency where we weren't available. I did have other colleagues that could cover for me if there were emergencies. But the continuity of care was there. It existed for this patient.
Yeah.
But there was no continuity of care with this patient. And
No.
she said, I know in one of the things I read, she said that she did try to see a psychologist for a period of time, but she just didn't jive with them. And, that happens. That's not unusual.
Well, her primary outpatient psychiatrist was Dr. Jennifer Tufts, who only had 4 months of experience before she took on Lyndsay as a patient.
Yeah.
And then I just want to read one thing because this goes with what you were saying. On December 20th, she underwent specialized psychiatric evaluation at the Women and Infants Hospital Center for Women's Behavioral Health in Providence. Early reporting described this in the plural, psychiatrists there. And she said the evaluators did not believe she showed postpartum depression. Mm-hmm. She subsequently entered the hospital's postpartum psychiatric day program, where she was assessed again. More recent court reporting says that the program concluded that her difficulties were more consistent with over-medication and misdiagnosis, and she wasn't appropriate for that program. By late December, she was reporting suicidal thoughts about harming her children.
I believe that some of the practitioners that were involved in one of those treatment programs, and again, some of my facts might not be exact, but I know that they tried to connect with and contact her treating psychiatrist, Tufts, I believe, Dr. Tufts. I think that they tried to reach her a few times because they were trying to get some continuity of care. And that's something that does really happen a lot in this field. You will find, even as a professional, that I might not be able to get a hold of a treating psychiatrist or psychiatric nurse practitioner. And when you fail to have continuity of care, especially in very serious cases, that's when things start to fall apart. Now, I'm not blaming it on any one person or even on the medication for that matter, because that's another story we discussed as well, Anthony, right? The medication. But I do know it's essential for anybody who's going to be in a serious situation like this, mental health-wise, to be getting continuous treatment with the same professionals and to have an open communication and contact line with any of the treating individuals. And when you don't, this kind of contributes to the situation that occurred. I'm not saying it's anybody's fault because it's hard to really say, it's this one's fault or this one's fault. But I do fault the treating physicians for not having any more continuity of care. And that's the problem in medicine, is that they keep prescribing for symptoms instead of looking at what is really going on with this patient, that they keep coming in for help and they're not getting better. They're not getting better. These medicines are not working. I read about one psychologist, Dr. McFillin, talked about there was no evaluation done on, they can do, I think, blood work, and I think they can do like a swab, in your mouth swab of saliva to see what would be a good fit medication-wise and what's ones that might be poorly fit to you, certain SSRIs and such. But none of those things were done. But not even that. She was never seen in person.
Yeah, and
These were
she
online.
Not only did it not work,
serious.
not only did it not work, she was complaining of severe adverse events and severe insomnia caused by these drugs. And
If I was seeing this person, I would demand to see it, and I don't currently have a full-time office. I would find a freaking space to see this person. I'd want to see her presentation in person fully, because I want to see. There's things that you can't see online that you can see when you see a person in person, right? And we all know this just from any social media stuff we do, whatever. Somebody that comes into the office, how do they walk in? How are they dressed? Are they hunched over? Are they making eye contact? Eye contact on the screen isn't the same as in person. What does she look like? How is she speaking? I mean, I guess you get a quality of the voice and the rapidness or the slowness in which they're speaking. But there's so much context that you lose when it's online treatment. And when it's online treatment for something this serious, then to me, it comes down to malpractice. I'm sorry to say that, but I really do believe that, because if I had if I had a person come to me with this serious of symptoms, I would not ethically be able to treat them unless I knew I could provide in person, in an office, therapy.
yeah, I mean, I'm not discounting how devastating postpartum depression and especially psychosis. What are the numbers of percentages of women that get psychosis?
So postpartum psychosis is very rare. The range is quite high. It between 1 in 500 and 1 in 1,000, which is a very large range. It's not very typical. And I can truly say I did treat somebody with this thing, which she definitely had this, but she got through it because we had two people, me and this one doctor, and I'm not saying it had to be just two. It could have been more if it had to be, but we were in constant communication with each other about what to do because it was such a serious crisis. I don't think this was happening with this person, and I don't know how well she was presenting and communicating. It sounds like she was in distress and trying to tell people she was.
Oh, yeah.
I don't know, again, I don't know her. I don't know all the details of her symptoms enough to say, I think there was a forensic psychiatrist that got on the stand for the prosecution and for the defense that talked about, they diagnosed her based on the review of all the records that they did.
Yeah, but they also, some of the doctors testified that they didn't know her whole history. They didn't know about how many medications she was on. There was no coordination.
Coordination of care.
She would have these severe, her severe, reaction to these meds. She'd go to the ER because it'd be middle of the night or whatever, and they would treat her for the symptoms and by giving her another medication.
I know.
And it was this just cascading, descent into complete madness.
Yeah, it's so tragic and so very sad. But I guess if you want to get into the other things about sanity and insanity and what's being discussed, in what's making this case in Massachusetts unique.
Yeah, so we use the term insane, but legally, what's the difference between a clinical term and a legal term?
So insanity is illegal. Insanity are legal terms. They're not used by us psychologists or psychiatrists to diagnose anybody. So when they're using the term insanity in most states, okay, every state has a slightly different definition, but according to some of the legal stuff I was following, is that in most states, insanity means a person is not mentally capable of conforming his or her actions to the law. Okay? Now, in most states, so therefore it doesn't matter if you have a mental illness and you still committed an awful crime, like a murder. However, in the state of Massachusetts, they're calling it substantial capacity. So it still has to come under the legal definition of sanity and insanity, okay? But so in order for her to be declared insane legally in Massachusetts, she has to be, during the time of the executions of her 3 children, she has to understand and have had self-control over her actions. But Massachusetts excuses a person who understood that the killings were wrong, but because of her mental defect or disease, she lacks capacity to control her conduct. So in Massachusetts, you can have a mental defect. You can know what you're doing. You can know it's wrong. You can know that you're planning to do it. For instance, you know your husband's home at work in the basement and you have to get him out of the house. Otherwise, if he doesn't get out of the house, he's going to stop you from doing it, right? So that's premeditated, right? So, but she can say, I can't help what I have to do. I have to do it because the voices are telling me it's the only way to keep my kids safe. So I have to kill them. In most other states, she would be found guilty of that. They would say in most states, it does not matter that you're suffering from a mental illness. You knew it was wrong. You should have taken steps to avoid doing this. It doesn't matter that you lack control, whether or not you have a mental illness. Your disease does not excuse you in most states of your inability to exercise control over your behavior. And this is what's happened in this country. I believe there's a movement here to say people can't help it. They have blah, blah wrong with them. They have, what do they have? I can't even think of that one everybody likes.
Neurodivergence. Yeah,
Neurodivergence.
my students
Neurodivergent. I have ADHD. I didn't mean to do this. I didn't have proper control over I have impulse control disorder. I have this, I have that.
Self-diagnosis as an excuse for aberrant behavior.
So that's what this feels a little bit like to me with this whole thing in Massachusetts.
Well, I'll make a prediction.
And I don't know what states have that caveat.
It doesn't matter. I mean, if she's in Massachusetts,
substantial.
That's all that matters.
Substantial
and Massachusetts,
capacity.
I predict this is going to be like the female white OJ trial, where she's going to. All you got to do is fill half the jury with these. Really, I think, completely misguided women who worship her and completely say they understand why she brutally murdered her children and that they would do the same thing because they get it. And these women are sick and dangerous. And not only that, there's already been copycats. A woman in North Dakota slit her kid's throat, tried to kill a couple of them, only killed one of them. And that poor baby now has to live with a horrible injury inflicted by his own mother. But I think, and now the family's gotten millions of dollars from GoFundMe. So not only what these women are doing is setting the precedent that it's okay to unalive your own children in a brutal fashion. Matter of fact, it's totally understandable and reasonable under the circumstances. But now they've created a model, a template where these other crazy people out there can say, oh, I can become, they're all posting all these things of them doing things to their children on TikTok, saying they get it, and they're rage screaming into TikTok. And I think a lot of this is just curated. They want us fixated on this.
Well, it's causing a contagion effect, right? You see that a lot.
Yeah, it's causing a
contagion effect.
But beyond that, you're what I'm trying to say is you're incentivizing more people to do it by saying, and any person who's psychologically disordered and sees this and is going through a difficult time with their children, say, oh, look at this. I'll be famous and I'll be rich and she's going to get off. I guarantee it. So I won't have to go to prison.
I don't know.
I'll make millions of dollars. This is what's going to happen to her, Christine. She's famous. She's making millions of dollars. And
happen to who?
And she's going to get away with it. This is what's happening to Lyndsay Clancy. She's being rewarded for brutally murdering her.
She's a martyr.
Children.
She's being portrayed a bit like a martyr, I guess, right?
And they're trying to twist it around without any evidence. There are all these internet wine mom sleuths that are saying that the husband did it. Meanwhile, This husband, this poor guy had to. People who have heard, they didn't play it. The judge wouldn't let it be broadcast, but the people who heard the call, like he went there and he got home and saw his wife and he was attending to her. He called it emergency services. He stayed with her because she jumped out the window and was just laying there paralyzed. And he stayed with her until the ambulance came, but he asked her, where are the children? And she said they're in the basement. And he thought, they're playing in the basement. She never said what happened. And he goes down there and they said, when you hear his screams of anguish when he sees his 3 children were murdered, they said it's one of the most horrific things they've ever heard. And he was, just in his defense, okay, because people were blaming him for this. And he, first of all, he was supporting her. He decided to work at home so she wouldn't be alone. He got her a nanny. She had daycare services. She had family help. She wasn't all alone, okay, with these 3 kids. She had lots of help. She chose this demonic, cowardly way to deal with the fact that she was overwhelmed by parenting. And I don't care what the excuse is. She needs to be in prison. Somebody needs to strangle her for 5 minutes. Because if it was a guy, I'd say the same thing. And everybody else would be saying the same thing. This is a demonic.
Look, Anthony, we don't look. You might be right, but okay, maybe you are, but there are a lot of other factors here, and I'm not saying this to excuse her at all, because the power of my empathy goes to these 3 children.
That's where it belongs. We should. I mean, they were robbed of their own life by their own mother in the most brutal fashion. The last thing they saw was their own mother.
She said she was doing it to keep them safe, and that's
what she said. We don't know what she really thought, because she wrote in her diary, "I hate being a mother," and a lot of other things came out from her confession.
Well, people are allowed to freely express themselves. That's what diaries are for. But look, she might have been over medicated. We don't see the thing with the medication issue. Also, is this: she was prescribed all these things. Yes. I don't know if she actually took them. Does anybody really know if she took them? I mean, look, I know that maybe that's besides the point right now. No, I don't really know.
The toxicology report they did on her, she did have medications in her system.
That day.
But not a lethal dose. Like she
wasn't trying to OD. She had it that day. We don't know how far back those
that's true. We'll never know that. Yeah.
Get evaluated. Right. I think they could stay in your system for a while, so it could be. But I don't know if she took all those drugs that were prescribed. I don't think the doctor should have been keep prescribing for this symptom, this and this symptom. And, so essentially, I mean, the bottom line as far as the legal aspect of this case is they have to prove that she had post or peripartum psychosis at the time that she committed these brutal murders of her children. And she's saying, one of the things that she's saying that adds to the psychosis defense, the postpartum psychosis defense, is that she had a delusion. The delusion was a persecutory one, that she had to take her children's life because her children would not be safe without her around. And she was planning to suicide. So she had to off her children before she offed herself because her children would not be safe without her around. And then the hallucination aspect that contributes to the diagnosis of the psychosis, postpartum psychosis, is the hallucination where reportedly there was a male voice explaining that that's what she had to do, the male voice was saying that that's the way she had to do it. She had to kill the children first before she took her life. It's called a command hallucination. So again,
that could be, listen, it could be this whole thing. I mean, there's a spiritual component to this. We're in a dark age. We opened as a society. I mean, when we unleashed porn on our children and we unleashed abortion up till birth, which they have now in Massachusetts, the same state she's in, they just celebrated it. I mean, we're talking about listen, abortion's one thing, but we're talking about a 9-month gestated human baby that's totally viable, full term. I mean, that's infanticide. I'm sorry. That's no longer, a reproductive choice. This is infanticide. And we are normalizing infanticide, and people are even celebrating. This is a spirit of Moloch. Moloch was the Babylonian god of child sacrifice. And this cult never died. It's been under the undercurrents in the elite. The Epstein Island emails are full of this stuff. They believe in child sacrifice. They believe in eating the flesh, consuming the flesh of babies, and they believe in the power of doing the most demonic thing you can, which is murdering the most innocent of human beings, because they have the closest to the God life force. And by squashing their innocence, it's a crime against God. And we're normalizing infanticide in this culture, and this is a reincarnation of the Moloch spirit. It's a mass societal-wide possession. We've opened this portal to darkness. And, I mean, just look around you. How anyone, 50 years ago, no one would celebrate this. Everyone would agree that this woman did a horrible thing and she needs to go to prison at the minimum. Now there's people who they're consumed with their own fame and their own narcissism.
She's a victim.
And it's also this, this third wave feminism, which is no longer about empowering women. It's about demonizing men. So they can't accept or believe that she's a woman responsible for her actions. They have to blame the husband. I mean, this poor guy. I mean,
I don't think they're not blaming him in the media.
Yes, they are, Christine. There are, with no evidence. They're all saying
in the mainstream media.
They are saying, thousands and thousands of them are saying that he did it. They have these.
There's conspiracy theories.
These internet sleuths are saying, they're finding things that aren't real evidence, so they're just making things up, and they're getting these people whipped into a frenzy, saying she's innocent and he did it and he's getting away with it, and it's misandry. It's that man has to be at the core of this, and but again, it goes to this divide. The more we're fractured and divided along male and female and black and white, gay and straight, and trans, and this, the more division there is. Oh, and by the way, these are the same women who viciously attacked someone like who's the woman who wrote Harry Potter?
J.K. Rowling.
They viciously attack J.K. Rowling because she says men don't belong in women's sports. Those same women will worship this woman who actually brutally murdered her own children. So it's like this.
It is a weird inversion, right? That's the word you used to use a lot.
It's
inversion.
A demonic possession, and I believe that Clancy somehow a demon. I mean, I don't know if that many drugs can change your consciousness to the point where you open a portal to this different sort of consciousness and dimension of darkness, but there's something spiritual here going on because
she could have had a psychotic break from.
She doesn't seem like she has a lot of remorse, and she's trying to use this defense to get away with it. I mean, how could you live with yourself if she's in her right mind now? If I was in a psychotic state and I did that to my own child, I couldn't live with myself. The guilt and the remorse and the
she apparently did try to kill herself.
What?
She did try to kill herself.
No, not really, because what she did was she kind of leaned backwards over the edge of the window and fell into the snow. She was with her feet facing the building with her head in the snow.
Yeah.
And supposedly she got paralyzed, but if she was really trying to kill herself, she'd be dead. Because if I was really trying to kill myself, I'd be dead.
Look. It's a very fine line to feel judgmental about this, but I mean, personally, and I shared this with you, and I think I'm going to share it here. Is if I tried to look at myself in her shoes, with empathy, and I was watching just a brief kind of piece of the court hearing where I think one of the pastors was testifying. And they were showing some camera on her with her attorney. And what I found interesting is that she was very engaged in her defense. She was jotting notes to pass to her attorney. And I guess, what I was personally thinking is when I was really, really ill, when I first, came home from the hospital after, a massive brain bleed, I was very sick. That's the only thing I can liken what she's gone through to is the trauma of the degree of what she's gone through to that.
Yeah,
But if I guess what I think for myself personally, if I can't even tolerate hearing this story, it's so, every time we talk about the children, I can't handle it. It gets very upsetting to me that if I knew that I killed those children, I would have killed myself
that's what I'm
successfully.
saying. That's what I'm
And
saying.
I wouldn't actually be wanting to defend myself. I'd want to be
Punished.
if I couldn't kill myself, I'd want to be put in prison for the rest of my life to suffer and be punished and, beat up by other people or maybe murdered by other people in prison. I
That's
don't,
that's that's the real maternal instinct, and that's what mothers and women are. They're the caregivers. They're the protectors. I mean, my God, when you see the one person you know is supposed to love you no matter what and care for you, actually brutally unaliving you, I mean, it is the worst possible crime imaginable. And she doesn't get a pass. I'm sorry. And she needs to show some remorse and she needs to be punished, because I'm telling you that if she doesn't get punished, you're going to see a wave of this. All these women who are posting
you're
on
already seeing a wave of it, you said,
we've already
right?
seen we're seeing copycats, but I'm saying it's going to be like
Yeah.
an epidemic. And I know this story is just
It's
awful. And
it's awful, and I feel compassion for the whole family, including her. But I guess at the same time, it's hard for me to not feel hostile or judgmental of her, and I think I'm struggling with that
yeah, there's other ways.
because
There's other ways to deal with this.
I
Obviously,
can't. I do feel that. I do also think it's interesting that she was a delivery nurse. I find that interesting that she was helping other mothers
yeah. Here's a conspiracy
bring
theory.
children into this world.
I wonder how many of those children she unalived.
Well, it is
Somebody should look into that.
interesting.
Somebody should research like suspicious deaths that she was there for, because this woman, I think, hates babies and wants to unalive them.
Well, she might be in conflict. There might be some kind of conflict there about why she's in that profession. I don't know. Sometimes people go into that profession because they love babies. So I'm not sure. And I don't want to dismiss all the women out there that experience postpartum
No, I'm not
and
dismissing those
the
women. I want to be
difficulties
clear.
of being a mother and not getting enough sleep, being sleep deprived, and having to wake up exhausted unendingly and losing that freedom and space that you had before you had a child. I can't fathom what it's like because I don't have a child. I can only try to imagine and put myself into somebody's shoes. And I know that it is really hard to be a mother. I just want to
You'd be a
say
great
that
mother.
out there as well.
You'd be a great mother. You have an enormous maternal instinct, and I know damn well, no matter how much postpartum depression you had, you wouldn't do something like this. You wouldn't never lay a finger on your child, and you would sacrifice yourself for your child. I know it, and this is inexcusable. And I know she was. I do believe she's a victim of a failed mental health system,
Yeah.
and a totally inept mental health system, and over prescribing and a lot of different things. But at the end of the day, she did something so horrific that we cannot give her a pass on it, and certainly not celebrate her. So
No. And again, it's those children. I can't even say their names. I'm going to cry if I say their names.
all right, well,
Cora, Dawson, and Callan.
Laura, Dawson, and Kala.
They're in my prayers.
I'm gonna show something here. This is a timer set for 4 minutes. I'm gonna start it. I'm gonna show how long she. It takes a lot of force with these bands because they stretch. So this is what this woman did to her own children.
Oh, don't do that. Please don't do that. Anthony, please stop. Can you All right, Anthony, come on, stop that.
I'm going to do it for 4 minutes.
No, you'll die. Please.
Well, I can still breathe.
No, please stop. Please.
But she had to pull on this thing.
Okay. How long has it been? How long has it been? Because you're all red and your veins are popping already. All right. How long's it been?
Three, 06.
So it's been a minute?
05. It's been a minute. That's 1 minute.
Okay. All right. You showed enough.
All right. So
Please.
4 times that.
All right. And
Held
on a weaker body.
That. And we're going to celebrate this woman? I don't think so.
And she did that 3 times.
I hold her to the same standard I would hold a man. If a man did this, nobody would come to his support. I mean, no woman, no man, and rightly so. So when she gets celebrated and they make the Netflix series and she makes millions of dollars and she gets off, all those things are going to happen. And it's just a dark reflection on a dark society that's lost its way and has opened a portal to hell. And if we don't get ourselves right with God and good and light within us, because we're a fractal expression of the cosmic consciousness, the divine masculine, the sacred feminine together create something holy called life. We have the godlike power to create life, especially a woman. And that is the most incredible, beautiful expression of their divinity, because they can literally create life. And then to take that life is a sin against God. It's a sin against your children. It's a sin against your family and humanity. And it's the worst thing a human being could do, especially a mother. So I want to thank you, Dr. Marra, for your expertise. And I know this has been very difficult for you. Christine was reluctant to do this, and I kind of twisted her arm. But I think it's important because it's one of those crystallizing events that shines a light into just how dark this society's gotten. So hopefully by shining lights into these dark places, we can look at it and say, what are we doing and what's happened to us, and try to reverse course. So thanks for watching, guys, and Godspeed, and we'll see you next time.
Thank you.
Thanks, Doctor.